You look so pretty today. I love your dress. Demetrius. I love you. How much? 2? Only 2? You only love me 2? Yes. I love you 7, 8, 9. Me too. That's a big number. I love you. Okay. I think you broke my bones. I think you're dead.
No, I didn't.
36-year-old Maria Garibay has a rare disease. She has limited physical ability, but this does not stop her from being affectionate toward her loved ones. Maria's nieces and nephews have learned to adapt to their aunt's condition. Maria's disease is just one of hundreds of rare diseases that affect people in the U.S. each year.
In the United States alone, there's 25 million Americans with rare diseases, most of them children. I have 550 rare pediatric diseases on my database. It's constantly growing. Rare diseases aren't so rare anymore, do you know? And people need to know that.
Marcy Smith is the founder and CEO of the Madison Foundation, a nonprofit organization whose acronyms stand for Moms and Dads in Search of Needed Support.
It's a website-based foundation that was started when my daughter was misdiagnosed with cancer. And when she was re-diagnosed with the rare disease, I found out how little information and support there was out there for those parents.
At the age of 4, Maria was diagnosed with Spinal Muscular Atrophy Type 2, a genetic disease that researchers and doctors say has no cure.
In SMA, in the spinal cord, there is a particular cell called the anterior horn cell, which is responsible for the nerve, which makes our muscles move. And in SMA, there is a deterioration of that cell. So there is miscommunication or a lack of communication between the brain and our muscles.
Chien-Ping is a neurology professor at the University of Southern California. He has conducted SMA research for the past 4 years.
Typically, this particular models, mice will die, say, 2 weeks. And after the compound treatment, they can live up to 2-3 months. So that's very, very significant.
Hopefully we can make some contribution to help the company to identify compounds and that can lead to clinical trials and hopefully become drugs available for patients.
According to Professor Ko, the future of clinical trials for SMA looks promising.
SMA is actually the #1 genetic killer of children under the age of 2. 1 in every 6,000 babies is born with SMA, and that's pretty high. And so 1 in every 40 people carries the gene that causes SMA.
Growing up until I was maybe teenage years, I had a really good childhood. I really didn't feel like I had a disability. I just thought I was normal. I had toys, like everybody did. I went to school, like everybody went to school. The only difference was that I couldn't walk.
But Maria's life has not been normal. For years, Maria's parents have been told that their daughter was in her last stages of life. The first time they were told this was when she was 2 years old and living in Mexico. In search of a better quality of life, they immigrated to the U.S.
Porque en México solamente me decían que era falta de calcio, que era debilidad que tenía, pero nunca me dijeron que esa enfermedad tenía. Me enyesaron una vez que porque no tenía tobillos y que por eso era que no podía caminar.
The charts all tell us in adulthood, but it's really hard to put a number on it, because SMA is one of those very heterogeneous type of diseases. The categories 1, 2, 3, and 4 basically tell you when was the diagnosis made and at what was the highest level of achievement they could do, either sitting or standing or walking. The reason why SMA babies seem normal at birth is because they can still use some of their mother's protein, and then they can no longer make any. people with SMA do have some SMN protein, just very little.
Me sentí muy bien, Javier, porque nos han dado tiempos muy bonitos, Javi. Hemos ido a la nieve, a acampar, has jugado fútbol, te hemos hecho cumpleaños y nos sentí muy bien porque tú has tenido buen tiempo con tu hermana, con tu mamá y conmigo. Y me hace sentir muy feliz. ¿Ok, papá?
10-year-old Javier Arreola suffers from cystic fibrosis, another rare childhood disease for which there is no cure.
Cystic fibrosis es una enfermedad genética heredada por los papás y esta enfermedad afecta en sus pulmones y sus intestinos. El niño produce flema pegajosa que se le queda en los pulmones y si el niño no tiene tratamientos diarios para limpiarle sus pulmones, el niño no aguantaría tantas neumonías. Y también sus intestinos no absorben nutrientes.
Cuando como, tengo que tomar estas pastillas para que ayúdenme para que pase a mis intestinos chiquitos.
Cystic fibrosis is a life-threatening disease. It affects 30,000 children and adults in the U.S. An additional 10 million, or about 1 in every 31 Americans, are carriers of the defective gene.
Conforme fue pasando el tiempo, vimos que era una enfermedad tremenda. A él le afectan sus pulmones y agarra neumonías muy seguido. Y el saber que tu niño puede estar bien ahorita y que mañana se te puede morir, eso para una familia es terrible.
It's changed me as a person. It shows me how to care for people, how to be understanding, and how to want to give help to others, because that's really what people need.
These are my treatments. I do them in the night and in the morning. Well, I have to start with my vest. It helps open my lungs so then I could breathe better, and so then mucus can't get inside my lungs. The disease is hard to deal with, but if you really try, it's like nothing. Like you could do, I could do mostly anything that a regular person could do. It's just the extra care.
As parents, there's a lot that they don't want to hear. You know, they don't want to really see that in a few years, I'm going to have to be on a ventilator. They don't want to see that there's going to be a point where I'm not going to be able to communicate.
You don't just do research on SMA. You need knowledge from other areas. This certainly would not be possible, say, 30 years ago without a technology now available these days. So this is the right timing.
Right now there is no real medication for SMA. A lot of our treatment is supportive, but there's a lot of research going into SMA, and they have done several trials of different medications. A lot of them have not worked.
There are many reasons why a cure is yet to be found for SMA and cystic fibrosis, but money is the bottom line.
Well, I don't think there's money to be made from pediatric diseases, period. Not as much money as adult diseases. In rare diseases, even less. I mean, you could have one disease where there's 2,000 kids, and that's just not making the money.
It's maybe too hard, or it's just like they need more information about the disease, and more medicine, and maybe a little more money to maybe buy the stuff or invent the medicine.
Other things that could be contributing is as far as the voice, you know, who's more vocal for where our funds go, where our taxpayer dollars go. That's not always SMA families that are louder.
El corazón debería de estar en los niños, porque los niños son el futuro de nuestras vidas. Y sí enfocarse más en las necesidades de los niños, que sería, como dice Karina, un gran cambio. O sea, sería una luz, sería un cielo para nosotros, una cura para Javier.
There's also an enormous amount of work for families to be able to help their loved ones through the day.
Después pensé que era mejor salirme de trabajar y estar con ella que volver a trabajar.
A las 8 o 9 de la noche, ahí empieza el trabajo como mamá. Ahí empiezo los tratamientos de Javier, empiezo a llenarle su bolsita de leche, empiezo a conectarlo, sus medicinas por el tubo, y yo termino alrededor de 11:30, 12 de la noche. En la madrugada, como toma leche, también tengo que darle pastillas. Me levanto a las 3 de la mañana a darle sus pastillas, y para amanecer tengo que levantarme antes de las 6 de la mañana a ponerle otra vez sus tratamientos.
Maria takes daily medications for acid reflux and anemia, but the most important treatment is what she must do to keep her lungs working.
The more and more my back was shaped again, it was turning into my lungs. And that in the end would have caused my life to be shorter.
You have no resistance onto those bones, they can get weaker. You get curved back or scoliosis. Your bones can get thin because of disuse.
Maria had spinal surgery to deal with this. Her surgeon placed a metal rod next to her spine, a procedure that her doctor said would reduce the chances of her getting sick often.
Everything that is a muscle in my body is in a with time decrease. My eyesight, my breathing, my heart. It's just something I know I have to deal with.
G-tube has to be placed pretty soon, because not only are they having difficulty swallowing, but in order to even keep the food into the stomach, you need some kind of musculature in your trunk.
But when it just happens from one minute to the next, and when it's something so big as the pleasures of eating, that's hard. And it was really hard on my family. My mom, she stopped cooking.
Yo nunca he comido enfrente de ella. A mí se me hace triste estar yo comiendo y que ella me esté viendo.
5 years ago, Maria lost her ability to swallow and now depends on a gastric tube for food, and someone must suction her saliva every 15 minutes.
I didn't want to be here anymore. I didn't want to spend my whole life on the bed in a room. I didn't want it. But I have a really good family.
There are some normal aspects to their life, but again, normal is how you define it. They can talk. Some of them actually do require to have a tracheostomy placed because their breathing muscles are so weak. They can't breathe enough. But they are still able to go to school. They're still able to participate in some social aspects.
I love you, Javi. Love you, Happy. I love you too.
Even though Javier is dealing with a different disease, he also had a gastric tube placed in his stomach when he was 8 years old.
Entonces ya llegó un determinado momento en que el doctor dijo, si no le ponemos esto, el niño no va a crecer de peso y él se va a enfermar de otras cosas. Fue cuando él decidió, y nosotros también como familia, ponerle el tubito en el estómago.
I have a G-tube and it helps me gain more weight throughout the night because I have medicine throughout the night. And before, when I didn't have this, I weighed like around 30 pounds. And now I weigh 65 pounds.
I see him with his tooth, and I feel like, damn, if I had it, it'd be different. I wouldn't feel comfortable with people. But as I see him and he doesn't care, he shows people, it makes me a better person.
Maria's life has been consumed with her disease. Still, she did have some relatively normal years. For example, Maria graduated from Narbonne High School, but it wasn't without challenges. She remembers being bullied during 8th grade.
It hurts to say that that was the first time I saw people judging me for who I was. I wanted to be an accountant because I felt that was something I had to do. I was good with numbers.
She continued her education at LA Harbor College until age 30. The downward progression of SMA forced her to quit school. At Rivera Middle School, where Javier is a 6th grader, he talks with other kids about his disease.
I do tell them, and just to know that all the kids that have it or have other diseases, that like it's not good to make fun of them, like more to encourage them and like tell them like it's gonna be okay.
Maria's progressive disease has brought changes in some of the more basic needs, like transportation. She has changed her wheelchair several times to accommodate her evolving mobility needs.
I just hate having to go through all of it. You know, sometimes even going out, it's like, really? Do I really want to go?
It's an uphill battle for them, and we know that. It's a big strain to the family, and they also probably need support groups. So it is very difficult for them to shuffle from one clinic to the next to the next.
I wish friends could continue to be supportive and not get frustrated and understand that's the case, and the parents need the constant support. You know, come over and see this child for a while. You know, give the parents some time. That's what we lose.
Marcy Smith's Madison Foundation unites parents of children with rare diseases.
Parents are going on from all over the world, and I'm connecting parents from, you know, China to Ohio, and they're sharing protocols with each other. Things I couldn't write down, they're allowed to share with each other. I think what's really hard with a rare disease is there isn't a community out there. In order to get one, you have to start it. Now, you're already overwhelmed with having this child with this rare disease. A couple of the congressmen have children that have rare diseases, so that's bringing attention to it. So as people are affected, parents and parents that work in Congress, it's going to become more of an issue, and I think that will help.
It would help a lot if there was more money, because I know money goes to other things, such as war and stuff like that. But yet people have to put themselves in the position that we're in, how it's like to have people like this, it's sick, and there couldn't be a cure with money, research, because everything's possible.
Funding for research for rare diseases is difficult because in 2011, the National Institutes of Health allocated $19 million to SMA research and $79 million to cystic fibrosis. This is not very much money compared to funding for non-rare diseases. Still, Maria, Javier, and their families remain hopeful.
Well, first I'm going to be a scientist to find the cure. Then after that, I'm going to quit being a scientist and be a doctor to help the kids. But maybe it's going to be a little too late, because I don't think they will need helping, because there will be a cure for it already.
Nos ha dado vida en nuestro hogar. Javier nos ha dado también mucha fuerza para seguir adelante, y también nos ha hecho entender que hay mucha gente allá afuera que necesita de un apoyo, necesita de ayuda, y él nos ha hecho entender que nosotros que estamos sanos podemos ayudar a mucha gente.
Love you all.
I think everybody would want a cure, especially if you're the one living with it. I don't know how much more time I have, and I know I'm such a big part of their life. When I'm not there anymore, I want my mom to be with me.
And the forehead.
On the forehead.